Understanding small cell lung cancer. When you inhale, the lungs transfer oxygen from the air to your blood. When you exhale, they take carbon dioxide from your blood and get rid of it. Lung cancer is a disease caused by the unchecked growth and spread of some cells in the lungs. In the U.S., lung cancer is the second most diagnosed cancer and the #1 cause of cancer death. Each year in the U.S., nearly 240,000 people are diagnosed with lung cancer, and approximately 130,000 die of the disease. Small cell lung cancer, or SCLC, is one of two major types of lung cancer. The other is non-small cell lung cancer, or NSCLC. Compared to non-small cell lung cancer, small cell lung cancer is more aggressive, more likely to spread outside the lung, not usually treated with surgery, and more likely than non-small cell lung cancer to respond to chemotherapy and radiation. Small cell lung cancer is the second most common type of lung cancer. Small cell lung cancer affects about 1 of every 10 people with lung cancer. While there is no single cause of small cell lung cancer, it is often linked to smoking. Like most other adult cancers, small cell lung cancer is caused by a buildup of damage to cells. Over many years, this damage gives some cells the ability to grow, multiply, and spread out of control. The possible causes of this damage are called risk factors. Lung cancer can be dangerous even if it does not spread. It can grow into important structures in the chest, such as the airway, or more commonly, it can spread through the bloodstream to other organs in the body. When cancer has spread to other organs in your body, it is called metastasis. Cigarette smoking is the biggest risk factor for small cell lung cancer. The risk increases based on how long and how many packs you smoked. Up to 2.5% of small cell lung cancer patients never smoked. Other risk factors for small cell lung cancer are being exposed at home or work to secondhand smoke, breathing someone else's smoke, radon, a radioactive gas found in the soil, arsenic, asbestos, beryllium, cadmium, chromium, nickel, soot, or tar, prior radiation therapy to the breast or chest, and up to 10% of EGFR mutant non-small cell lung cancer transform to small cell lung cancer. Other risk factors can also include living where there is air pollution, having parents or siblings with lung cancer, having had other types of cancer like breast cancer, colon cancer, or prostate cancer, having had lung diseases like emphysema, chronic bronchitis, chronic obstructive pulmonary disease, or COPD, and tuberculosis, and aging. The symptoms of small cell lung cancer are not specific. Possible symptoms are a cough that won't go away or gets worse, coughing up blood, rust-colored spit, chest pains that get worse if you take deep breaths, cough, or laugh, and hoarse voice. Other symptoms include weight loss and loss of appetite, shortness of breath, feeling tired or weak, a lung infection such as bronchitis or pneumonia that won't go away or keeps coming back, and wheezing with no known cause like asthma. Researchers haven't found any drugs, vitamins, herbal remedies, or alternative medicines that can help prevent lung cancer. The most important thing you can do to lower your risk of small cell lung cancer is don't smoke, such as cigarettes, cigars, and pipes. Other things you can do: avoid secondhand smoke, avoid radon and other cancer-causing chemicals, eat a healthy diet, and if you get your water from a well, test the water for arsenic. Having a small cancer that hasn't spread outside the lung increases survival. Small cell lung cancer is commonly treated with chemotherapy and/or radiation therapy. Other treatments could include surgery, immunotherapy, or clinical trials. Your options depend on your cancer stage, type, size, location, and spread of the tumor, biopsy and blood test results, symptoms, age and general health, and preferences. Your doctor will explain the recommended treatment options. Make a plan together. Ask lots of questions. For example, What stage is my cancer? What are my treatment options? What side effects can I expect? How can I prepare for treatment? What are the goals? And how likely is it to succeed? When you meet with your doctor, be sure to explain your worries and wishes. Consider getting a second opinion, and ask if there are any clinical trials you could join. Ask your doctor if your cancer can be cured. New treatments have helped people with small cell lung cancer live longer than ever before.